Dr. Zachariah, what are some advanced techniques that you're using for diabetic wound care?
Now you're in my wheelhouse. I mean,
we did read up a little bit.
basically, some advanced techniques we're seeing now are basically identifying earlier on, until there's, identifying things before they become a problem. That's going back to the arterial vascular studies that we do here. Number two is, once you identify the source of the problem with the wound, why it started, whether it's diabetic, if it's an arterial issue or a venous issue, pressure, is to try to identify those things. And everyone's good at doing that. The third thing are basically, we call skin graft models. The model back in the 60s, 70s, 80s was basically harvest skin from themselves and then put that to the area that was affected to try to get, to acquire healing. But now you have to heal 2 sites instead of 1. Things now have turned to pigs, cows, fetal foreskin. Now the new wave is stem cell therapy, which is very controversial, they say. But essentially, our job is, as a specialist in doing wound care, is to identify an ulcer and quicken the healing time and put every factor you have in place to get that to happen, whether it's nutritional factors because they're obese or they're demineralized because they're not taking enough food in. If they're on dialysis, try to balance out, their diet so that you can get the most appropriate setting for healing. But we're finding now that we do multiple types of grafts. And I don't want to bore you, but there's autografts, which means from yourself. There's xenografts, basically from a different species. And there's isografts, which are more the synthetic variety. And essentially they're coming down to, we're using the intestines of pigs to basically layer over a wound to promote healing. We're using also cows, part of their intestine also to blanket it. We're using collagen-based grafts now. They're very popular with burns, where basically they're pregnant with collagen, they cause a scaffold. So if you have a large deficit, say this is your leg or arm, this is something that you put on that helps the skin incorporate, promote moisture, and reduce bacterial load so they don't get infected. The new thing now is basically amniotic or stem cell therapies. They're actually doing injectable versions of progenitor cells. So if you go in the amniotic fluid, there's no more growth factors present than in that area. So they safely deliver the baby. There's no problems with that. And through the cesarean, they donate the fluid, they sterilize the fluid out, and you're getting multiple growth factors. What that means is growth factors are going to give you a more enriched environment to promote healing. We used to use something called PRP, which is basically they draw your blood and they spin it down to 5 or 6 different growth factors and re-inject around tendons or ulcers. The problem is, as you mature, the potential of your growth factors or strength lessens. So I'm taking a diabetic, 7-year-old diabetic, and re-injecting his growth factors, and you're not helping him. So now take an amniotic cell or a stem cell from the fetal placenta and inject that. Now you're talking. So these are things now that are limitless. We use things like wound vacs, which are essentially, we call vacuums that cause negative pressure. You put a patch over, and what it does is puts gentle suction on the area and basically helps the tissue come up into that area. So you can fill it if there's a depth or if there's anything that probes down or deeper. Yeah. There's skin grafts or flaps where we actually advance or rotate. So if you have a deficit here, I can actually rotate a deficit here and close both. These are some of the things we're looking at. Hyperbaric oxygen, having the ability to work out at Bryn Mawr Hospital Wound Healing Center. Our whole group works there. They actually have chambers that you can go into that can super saturate with oxygen and basically also promote healing.